Hello again, welcome to MedSynapse podcast. Today we'll invade new era. It's related to beauty standard. So we are so glad to announce about our guest today. He is Dr. Matteo Vigo, a plastic surgeon specialized in breast enhancement and cosmetic surgery. Welcome, Dr. Matteo, on board.
Hello, thank you so much for having me today. It's a real pleasure. So I'm Dr. Matteo Vigo. I'm a plastic surgeon. I am Italian by origin. I graduated in Milan. I did my residency in Verona. And after a few years of practicing as a private practitioner and freelancer in Italy, I decided to move to Dubai in 2013. So it's 11 years that I'm in Dubai. I have an established practice and I perform mostly all the plastic surgery procedure, but especially I'm focalized on breast. Is my passion, is what I've been trained for a lot, because I was working in a very big breast reconstruction center when I was in Italy, and that is the main reason why I am so passionate about that. I've seen all the kind of procedure that everybody can imagine on the breast, and I'm very focused. I think breast is a very important part of a woman, and that's why I want to always enhance it and make it better for them.
It's a great experience and wide as well. So I'm so interested to proceed this episode about Femtech, which is related to breast enhancement and beauty standard related to women. So Dr. Matteo, we will start from the basic. And so what is Femtech and how does it differ from traditional ways?
So Femtech is a new concept that has been introduced in the market a couple of years ago, only 6-7 months ago in the UAE. It's a concept where we are not looking to enlarge the breast to make the breast look bigger. We want to enhance. There's been a study among 19,000 women where they were asking if they use a compensatory behavior for the breast, like padded bra, push-up bra, or any kind of clothes that can mask the loss of volume after maybe a pregnancy, a weight loss, or simply a small breast that the patient never developed completely. And 79% of women are using compensatory behavior, which is a huge percentage of patients. And among these, more than 80% are not considering a traditional breast surgery. They don't want to undergo general anesthesia. They don't want to have a long time of recovery because they are working moms. They have kids, full-time jobs, busy lifestyle, especially Dubai. The life pace is really, always running. So people don't have the time to recover properly. And Femtech is the solution of this problem. Femtech is a new technology, all designed around women. That's why it's called Femtech. Femtech stands for feminine technology, female technology. So all the kind of technology that can help women to feel better about themselves, to empower women. If you consider that in the $12 trillion worldwide expenditure for healthcare, only 4% is dedicated to women's health. You understand that this project has a huge impact on their, mental well-being and how they can perceive themselves in a society. So the inventor of Femtech really decided to find a niche program, a niche project to give back the women what they have lost, though they never had, in terms of volume enhancement, and not augmentation.
This will be great. So, Dr. Matteo, what are the benefits of Femtech over the traditional ways?
The main advantages are the fact that Femtech is done under local anesthesia with a little bit of sedation. The patient can decide if they want to be fully awake or if they want to be a little bit more sleepy. Okay, they will discuss with the anesthesiologist, but they can be absolutely totally local anesthesia if they want. There is no pain or discomfort with the procedure. The whole experience lasts 90 minutes, which is the patient comes. I will be in the clinic. We'll do the drawing. I will do the preparation of the patient. We transfer her to the treatment room. We do the procedure. The patient goes back to the lounge, and then the patient will leave for good after 90 minutes. So the whole procedure is about 15 minutes. So in 15 minutes, the patient can have an enhancement of the breast. How does it work compared to traditional breast augmentation? They design a special kind of implants, and we will talk about it later, where with a very small volume can achieve a maximum projection. The incision is done under the armpit, which is a very minimal. And from there, basically, I inject the implant with a special gun, and this will allow me to have immediately the volume enhancement that I'm looking for, and the shape enhancement that I'm looking for. I suture very briefly the scar into the armpit, and the patient is ready to go.
Yes, it's fantastic. So, Dr. Matteo, you already mentioned the steps of this procedure. So, it's very scary about the procedure, especially related to surgery concept. It make a horrible effect on a lot of women. So, there is a specific, maybe, or more details, procedures, steps related to Maya Femtech over that you mentioned.
Yeah, Mia Femtech is an experience. The patient needs to understand this is not a surgical procedure. It's an experience like you are going to have a facial treatment or you're going to do your nails. Of course, it involves a surgical approach, but being so easy, so natural, it is really allowing the people, the consumer, to go back to their normal life the same day. I had patients who came, did the surgery the day after, they took a plane, went back to the the original country. I had other patient who went to the mall the same night. Patient went to have lunch with the friends after the treatment with no discomfort, no pain, and basically immediate return to their normal life. In a traditional breast augmentation, even though I do a preserved technique, which means that I don't disrupt too much the breast tissue, we can still consider there is quite a longer recovery compared to Mia Femtech. The patient might have a little bit more discomfort, there is a little bit more pain, the bra has to be worn for a longer period of time. They undergo general anesthesia, while here we're doing only, again, a little sedation. And with Mia Femtech, the patient will forget to have an implant after a couple of weeks the procedure itself. So they are absolutely, amazed by that.
Yes, exactly. So, Dr. Matteo, it's a critical point for all women about recovery process. So, what is the benefits of recovery process after Maya Femtech compared to the traditional ways?
As I said already, the difference basically is in Mia Femtech, we don't have cutting on the breast tissue. The breast tissue is totally preserved. Because we enter underneath the breast tissue, we expand the tissue, we don't cut it. I don't use the cauterization device at all. There is no blood, it's bloodless procedure. So the disruption of the tissue, the nerves, the fibers is not there. That's why the recovery Mia Femtech is so quick and easy and compared to the tradition. In the traditional breast augmentation, again, I repeat myself, I do a very minimally invasive breast augmentation. I try to respect the breast tissue as much as I can, but I need to use a cauterization device. I need to disrupt some fibers and to create the space for the implant. Most of the time in a breast augmentation, we go with a bigger implant compared to Mia Femtech. And that's why we need to create more space and we have this need to have a bit longer scar, etc., etc. With Mia Femtech, all these problems have been completely removed. And the recovery, it's mostly 2 or 3 times longer in a traditional breast augmentation than Mia Femtech.
Great. So, Dr. Matteo, a lot of women proceed some procedures and so on to feel satisfaction. So, what about the satisfaction rate of patients related to Mia Femtech?
Well, I was quite shocked when it presented to me and seeing their satisfaction rate that the company has created this technique introduced to us. And I can easily tell you that my patient, we usually do a questionnaire the day of the surgery, the day after, and 3 days after, okay, and a month time. The day of the surgery, we ask about the pain level, the mobility, how much they can move their arms, and the aesthetic result satisfaction, because they're able to look at them immediately. So they can open their bra, they can see immediately what is the result. And the result is like 2 on a scale from 1 to 10, is a 2 for the pain, is an 8 for mobility, mainly because the patients are scared to move them, and it's an 8 for the aesthetic result. Important to say that at the beginning, the implant sits a little bit high, and we need to give the time to settle. But already on the 3rd day, the pain drops back to 1.2, the mobility goes up to 9, and the aesthetic appearance is 9.4. So already in 3 days, the patient has a 9.4 out of 10 valuation of the aesthetic result. So the satisfaction rate, better explained than this, I cannot say.
Yes, exactly. I think it's overall expectation related to patient. So,
Yeah.
Dr. Matteo, regarding and respected to patient expectation, especially in terms of long-term results, what about this expectation?
The implant of Mia Femtech are the implants that I use in traditional breast augmentation. It's called Motiva. It's from Establishment Lab, which is a Costa Rican company. These I'm using for 7 years, and I never had problems with that. They're really resistant, they're really durable. The elasticity of the implant is incredible. They don't cause a capsular contracture compared to other implants, or at least the risk of a capsular contracture with them is much less. A lot of patients ask me, are the implants for the rest of your life? And I said, theoretically, yes, because if the implant doesn't have any problem, why do you have to change them? Okay, is there, you don't have problems, you check them with an ultrasound and MRI if it's needed. There is no problem, you continue to have them, and you can die with them, you can bring them to the grave. There is no issues. Most of the time when I change the implant, in additional, and Mia Femtech, I started 7 months ago, so I don't have to change anything at the moment. But in the future, it will be just because the breast of a woman will age like the rest of her body. So in 10 years from the operation, the breast will look different from what the patient is used to see. And that's why maybe they want to go bigger, they want to remove the implant, they want the lifting. But the risk of having a problem with the implant itself is really minimal. Okay, so I'm confident to say that this kind of implants can really last for a lifetime. They have a warranty for a lifetime, so there should be a reason.
Exactly. I guess it's a win-win situation for all departments. So,
Yeah.
Dr. Matteo, I want to ask about a bit about a specific candidate for Mia Femtech surgery. Are there any maybe patients or women can benefit from Mia Femtech more than or extra benefits from Mia Femtech over the all women?
Yes, so definitely there are some indication from Mia Femtech. Is not for everyone, unfortunately, not yet. There will be a lot of changes in the future. There are, updating the technique. It is a brand new technique, but of course the research and development department of this company is always running to find the best options. At this point, Mia Femtech is for women who are looking for 1, maximum 2 cup size more. We don't have a major ptosis, so major falling of the breast that require lifting. They didn't have a previous breast procedure, so they don't have implants. They didn't have undergo maybe a mastectomy or some other kind of treatment for cancer diseases, for example. They don't have a massive asymmetry in between the breasts. I always tell my patients that breast assisted are not twins. So a little asymmetry is fine, but the asymmetry is too much. We need to have a traditional procedure to adjust this kind of difference. People want to have a subtle and natural enhancement of the breast. They want to get rid of their push-up and padded bra. That's what Mia Femtech designed for.
It's a great till now. So, Dr. Matteo, we will delve into the most critical point related to breast enhancement procedure, which is safety and risk development. So, Dr. Matteo, what are the potential risks and the complications associated with the Mia Femtech?
The technique is very safe. Before being launched in the market, has been studied for more than 7 years in the labs. So they were trying on mannequin, and they were trying to understand if the way to approach the size of the devices, the size of the implant, etc. I can tell you that it's a very safe procedure. It's a procedure that where the risk of complication is very close to zero. No procedure is zero risk, of course. If you drive a car, you have a risk to have a car accident. But if you're a skilled driver and you know how to avoid the problem, your risk comes close to zero. And in this situation, the procedure is really safe in this sense. There is also another important thing. The company who developed this technique is not giving this possibility to all the surgeons. They are selecting the surgeons that they think are the most skilled. So the one who has used the most their implants, the one who have proven success rate on the traditional breast augmentation. So people who knows the anatomy of the breast and can deliver consistent results. I am one of the first in the UAE. We are only 3 doctors at the moment in the UAE. I'm one of the first, and I've done already quite a good number of procedures, and I can tell you the technique done in the proper way is very safe. There are no risks. The complications sometimes can be the scarring, which is a complication that it happens in any kind of surgery, because we don't know how much the skin of the patient will react to the scarring process. And I can be the best surgeon in putting the best stitches and suture. The patient can be the best patient taking care of the scar the way we want, but the skin of the patient will decide that scar needs to be hypertrophic, visible, and red. And that, of course, we need to treat it in a second stage. Other kind of complication is quite I've never seen major complication at the moment, and patients are actually very happy. So apart from the initial 2-3 weeks where the implants again sits a little bit high and the shape is not absolutely perfect, but I know how much it will change. When the patient come back at the 3 months follow-up, they are absolutely amazed by it.
Actually, it's really great and perfect point of view about Femtech, as it's a newly launched technology related to female. So we have to make a resource insightful resource from trusted expert like you, Dr. Matteo. It was a pleasure to meet you today, and really it was very valuable resource for all women.
Thank you so much. Anyone can reach me. I'm very active on social media, so if they want to know a little bit more about Femtech, I have my social media account, my Instagram account. My website also is very full of information about that. I also did other podcasts about that, so they can check my YouTube channel as well, and they can reach out to me if there is any question related to that.
Yes, of course. Thank you so much, Dr. Matteo, for having you today on my side and making valuable insights and sharing it with MedSynapse. Thank you so much.
Thank you so much.